Hello, practical nursing students at Jackson College. My name is Darlene Lopresso, and I'm a nursing instructor here at the college. Today we're going to talk about discontinuing a peripheral IV site. So we have our model here, but let's first take a look at this shadow box. IV sites, peripheral IV sites are used for IV administration, and you'll learn more about that in pharmacology. And these different colors represent all the different sizes of IVs that we have. And you don't have to learn that now, but in clinicals we'll be asking you to start learning the different sizes and the different shapes, because as an LPN you cannot insert these in the state of Michigan unless you are specially trained, and we do not do that here at Jackson College. So your scope of practice only covers discontinuing the IV site. And then the bottom of the shadow box just shows you all the different sizes of syringes that you'll be working with and encountering in the healthcare facilities. Okay, so I have my model here, and she has her IV site in, and she's going home, so we're going to discontinue this IV site. Now when you're assessing an IV site, you want to look for any redness, swelling, pain, so you'd ask the patient, and then also just observe for any redness or swelling around the insertion site. This is the insertion site. Notice also that we have the size of the needle, the date, and the initials of the person that inserted this angiocath. That's very important because according to the Intravenous Nurses Society, they need to be changed every 3 days, or according to hospital policy. So this patient's going to go home. We're going to go ahead and take this out. So I have my gloves, I have tape, I have a 2x2 or a Band-Aid if you want to, but some people bleed a little longer if they're on anticoagulants, so I use a 2x2, and I have one opened already that I'm going to use, and I have an alcohol swab just in case. Now with these IV sites, hand hygiene first. So here's my hand hygiene. Anytime you put your gloves on and anytime you take your gloves off, right, you're doing hand hygiene. With the IV sites, we're going to remove the dressing towards the insertion site. We don't want to pull it away from the insertion site because you'll remove the catheter prematurely, and we don't want to do that. If there's a lot of jiggling around of the catheter inside of the vein, you're going to cause damage to the what's called the intima, the inner lining of the vein. So I'm going to demonstrate that. I'm also going to get a piece of my tape ready to go. And of course explain to the patient what we're doing, and she's excited. She gets to go home. Mrs. Smith, I'm going to go ahead and take your IV out, so you just relax, and I'm going to hold it firmly. Again, we don't want this IV moving around inside the vein. It's plastic, there's no needle in there, but still the plastic can do damage. So we're just going to slowly, this is a tegaderm, it's a see-through tape, and then the white part is called a chevron. Now there's some controversy right now with the Intravenous Nurses Society on whether we should chevron IV sites or not, because they feel like it's a source of contamination to the site. So those, that may change and you may not see the use of those. And just go kind of slow, hold that IV site, hold the skin down, because these tegaderms kind of melt into your skin and it's not comfortable when you take them off. Okay, so again, I'm pulling towards the insertion site. Towards the insertion site. I'm going to lift up the wings of the chevron. This is where it's inserted. So I'm going to take my 2x2 and fold it over. And as I pull the needle out, I'm going to apply pressure. I don't want to apply pressure right on the vein while the catheter is still in there, because again you're going to damage the inside of the catheter. So take the needle out and then apply pressure as soon as you've removed the needle. So I would apply pressure for a little while depending on your client, and you can tape it into place and it'll stick to your gloves. And then you want to assess the tip of that catheter that was in the patient. You want to make sure it's intact, is what we call it. You don't want to notice any tears, or if it appears like it was torn or ripped or part of it is missing, that's not a good thing. That means it's circulating around in the client's body, and that's called a catheter embolism. So you want to inspect the end of that catheter, and if you're not sure, again, have one of your instructors or another nurse assess that with you. And then when we document this in the chart, we document what size it was, what time and date that we removed it, the assessment of the site that there was no redness or tenderness, no pain, and that the catheter was removed intact. And that is the end of discontinuing an IV catheter.